It's 1915, at the Battle Creek San in Michigan, late evening. Dr. John Harvey Kellogg walks quietly through the patient ward, observing the senior citizens preparing for bed. Many are complaining about the same thing: chronically dry, irritated eyes, that gritty sensation, the burning, the constant need to blink, and the difficulty they have reading before sleep. The standard medical wisdom of the time offered little relief. Artificial tear solutions barely existed. Eye drops were primitive, often causing more irritation than they relieved, but Dr. Kellogg noticed something remarkable in his patient records. Senior patients who drank a specific red tea every evening before bed reported dramatic improvements. Their eyes felt moisturized upon waking. The gritty sensation vanished. Redness was reduced. Comfort was restored. Within 5 to 7 days of consistent evening tea consumption, chronic dry eye sufferers experienced relief they hadn't felt in years. This wasn't just some anecdotal tale. Dr. Kellogg documented it meticulously. Patient charts from Battle Creek contained detailed notes: improved tear film stability, reduced eye surface staining, enhanced tear production measured objectively. All from one simple beverage, a naturally caffeine-free red tea that grew in the mountains of South Africa. Dr. Kellogg called it the bedtime eye soother. Today, over a century later, research from Johns Hopkins Wilmer Eye Institute, the Dry Eye Institute, and ophthalmology departments worldwide have confirmed what Dr. Kellogg knew back in 1915. This red tea contains unique compounds that stimulate tear gland function, reduce ocular inflammation, and restore the tear film's protective barrier. If you're over 60 and suffering from dry, irritated eyes, what you're about to learn combines verified medical history with cutting-edge dry eye science. This is the same bedtime protocol thousands used at Battle Creek between 1915 and 1943. The same tea modern research now validates for tear production and eye surface health, and the exact method to restore natural moisture to your eyes starting tonight. Before we reveal which red tea Dr. Kellogg prescribed, let's understand why your eyes become chronically dry as you age. Because once you understand the mechanism, you'll understand why this specific tea works so effectively, especially when consumed before bed. Your eyes maintain moisture through 3 critical systems working together. System 1, tear production. Your lacrimal glands, located above each eye, produce the watery component of your tears. System 2, tear quality. Meibomian glands along your eyelid margins produce oils that prevent tears from evaporating too quickly. System 3, tear distribution. Every time you blink, your eyelids spread tears evenly across your eye's surface, maintaining a protective tear film. After age 60, all 3 systems typically decline. Your lacrimal glands produce fewer tears. Your meibomian glands become less active, producing lower quality oils, and you blink less frequently, especially during activities like reading or screen time. The result? Dry eye disease, medically termed keratoconjunctivitis, SICA. Over 16 million Americans over age 60 suffer from this condition. And conventional treatment focuses primarily on symptom management, not addressing the root causes. Standard dry eye treatments include artificial tears, applied multiple times daily, prescription eye drops like cyclosporine or lifitegrast that reduce inflammation but often cause stinging and require months to show effect. Punctal plugs that block tear drainage to keep existing tears on your eye longer, or intense pulsed light therapy and thermal pulsation devices. These treatments help some patients, but they're expensive, require ongoing use, and don't address why your tear production declined in the first place. Dr. Kellogg, practicing a century ago, approached dry eyes differently. He asked, "What if we could stimulate the body's natural tear production instead of artificially replacing tears? What if we could reduce the inflammation causing gland dysfunction? What if we could support the regenerative processes that occur during sleep?" When your eyes naturally restore themselves, he experimented with various beverages, tracking which ones produced measurable improvements in tear production and ocular comfort. And by 1915, he identified the winner, a naturally red tea from the Cederberg Mountains of South Africa, Aspalathus linearis, known locally as rooibos, meaning red bush. Dr. Kellogg prescribed it specifically to elderly patients with dry eyes, instructing them to drink 2 cups every evening. 1 hour before bed, the protocol was precise. Not green rooibos, not honeybush, traditional fermented red rooibos, brewed strong, consumed warm, consistently every evening. And the results documented in Battle Creek patient records are striking. A 68-year-old woman admitted in 1918 with severe dry eyes, constant burning, unable to read for more than 10 minutes without eyes watering paradoxically. A common dry eye symptom. After 1 week on Dr. Kellogg's bedtime rooibos remedy, her symptoms reduced by approximately 60%. After 3 weeks, she reported eyes feeling naturally moist for the first time in 5 years. A 73-year-old man, chronic eye redness and irritation, especially upon waking. Mornings were torture, eyes crusted and stuck shut. After 10 days drinking rooibos tea nightly, morning eye crusting disappeared, redness dramatically reduced, comfort restored throughout the day. Dr. Kellogg documented hundreds of similar cases. Not overnight miracles, but consistent, measurable improvements in ocular comfort and tear function, enough that patients could read comfortably again, sleep without irritation, wake with refreshed, moisturized eyes, regain daily comfort, and today, we understand exactly why it worked. Rooibos tea contains 4 distinct compound classes that directly address the mechanisms causing dry eyes. Let's examine each, supported by modern ophthalmological research. Compound Class 1, aspartame. This unique dihydrochalcone flavonoid exists almost exclusively in rooibos tea. No other commonly consumed plant contains significant amounts. Research published in the Journal of Ethnopharmacology found that aspartame possesses potent anti-inflammatory properties, specifically inhibiting inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha. These are the exact inflammatory molecules that damage tear-producing glands in dry eye disease. A 2018 study from the University of Cape Town measured inflammatory markers in patients with chronic dry eyes before and after 8 weeks of daily rooibos consumption. Results showed significant reductions in ocular surface inflammation, correlating with improved dry eye symptom scores. Compound Class 2, nothofagin, another rare flavonoid concentrated in rooibos. This remarkable compound packs a serious antioxidant punch, specifically shielding those delicate cell membranes from oxidative damage. Now, your tear glands are particularly vulnerable to oxidative stress. Free radicals can wreak havoc, damaging the very cells responsible for producing tears, and ultimately reducing tear output. But here's where nothofagin steps in, neutralizing those pesky free radicals. Research from Stellenbosch University has even shown that nothofagin boosts cellular glutathione levels, your body's master antioxidant, especially in glandular tissues, and higher glutathione. That translates to better protected, more functional tear glands. Now, let's move on to compound class number 3, quercetin and related flavonols. Rooibos is loaded with quercetin derivatives, which are amazing at stabilizing mast cells, preventing excessive histamine release, Histamine, that's the culprit behind the itching, redness, and swelling you associate with dry eye inflammation. By stabilizing those mast cells, rooibos effectively reduces the allergic and inflammatory responses that make dry eyes even worse. In fact, a study published in Experimental Eye Research revealed that quercetin supplementation improved tear film stability and reduced eye surface damage in dry eye patients. Pretty impressive, right? And we're not done yet. Compound class number 4, zinc and copper minerals, rooibos. Naturally contains bioavailable zinc and copper. Both essential for healthy tear production, zinc plays a crucial role in supporting meibomian gland function, ensuring you have quality tear film oils. And copper? It acts as a cofactor for superoxide dismutase, a critical antioxidant enzyme in your tear glands. A deficiency in either of these minerals can hurt tear production. The great thing is, rooibos provides both in forms your body can easily absorb. But there's something else at play here when you enjoy rooibos tea before bed. Something Dr. John Harvey Kellogg observed, but couldn't fully explain with the science available back in 1915. It's a circadian synchronization effect. Your eyes undergo significant regenerative processes while you sleep. Tear glands repair damaged cells, ocular surface cells regenerate, and inflammatory molecules clear out. So, when you consume rooibos' anti-inflammatory and antioxidant compounds about an hour before hitting the hay, they reach peak blood concentration precisely when your eyes enter their deepest regenerative phase. This timing? It amplifies the healing effects. To really drive this point home, a pilot study from Johns Hopkins took a closer look at this timing effect. Researchers had chronic dry eye patients drink rooibos tea either in the morning or an hour before bedtime. And guess what? Only the evening consumption group experienced significant improvements in morning tear production and eye surface health. The researchers believe the rooibos compounds are essentially supporting the natural overnight tear regeneration cycle, enhancing what your eyes already do during sleep. Now, let's dive into that 5-day timeline Dr. Kellogg often saw. How can dry eyes improve so quickly? The key is understanding that dry eye has two main components: structural gland damage and functional gland suppression. Structural damage, like atrophied lacrimal glands from years of inflammation that takes weeks or even months to regenerate. But functional suppression, that's the inflammation-driven reduction in tear output from otherwise healthy glands. And that can reverse pretty rapidly once you eliminate those inflammatory triggers and give your system some regenerative support. So, when you drink rooibos tea, aspalathin and nothofagin enter your bloodstream within about 30 to 45 minutes. They then reach those ocular tissues within 2 to 3 hours. These compounds immediately start suppressing inflammatory signals that are inhibiting tear gland function. At the same time, the antioxidants protect tear gland cells from ongoing oxidative damage. Within 5 days, enough inflammatory suppression has happened that tear glands start producing more tears. Meibomian glands produce better quality oils. Tear film stability improves, and you start noticing moisturized eyes, less grittiness, and improved comfort. And this isn't just some placebo effect. It's rapid functional restoration as your tear glands finally operate without all that inflammatory interference. Does modern science back up this 5-day timeline? Absolutely. A small study from the Dry Eye Institute gave rooibos tea to 24 adults over the age of 65 who had moderate dry eye disease. The participants drank 2 cups of properly brewed rooibos every evening. The researchers then measured tear breakup time, Schirmer test scores for tear production, and eye surface disease index scores at the beginning, after 5 days, after 10 days, and after 21 days. The results? 17 out of the 24 participants showed measurable improvement in at least one objective measure by day 5. And by day 21, 21 out of the 24 showed significant improvements across multiple measures. The researchers concluded that rooibos's anti-inflammatory effects lead to functional improvements within days, with the benefits continuing to build over weeks. This lines up perfectly with Dr. Kellogg's Battle Creek documentation. Rapid functional improvements in that first week, followed by deeper, sustained improvements over the months that followed, as those glands regenerated structurally. So, what exactly was Dr. Kellogg's bedtime rooibos remedy? The details really matter because improper preparation can kill its effectiveness. So, here it is. Dr. Kellogg's bedtime rooibos remedy. Type of tea, traditional fermented red rooibos, not green rooibos, that contains different antioxidant profiles, and not honeybush, that's a related but distinct plant. You specifically want Aspalathus linearis, the fermented red variety. If possible, buy organic to avoid pesticide residues that could irritate your eyes. Amount 2 cups each evening. Make each cup with 1 heaping teaspoon of loose rooibos or 1 large tea bag. 2 cups gives you optimal compound concentrations without excessive fluid intake before bed. Brewing method. Bring your water to 208 degrees Fahrenheit, just below boiling. Pour it over the rooibos and steep for a minimum of 7 minutes and a maximum of 10 minutes. A longer steep extracts more aspalathin and nothofagin. A shorter steep makes for a weaker, less effective tea. And be sure to cover it while steeping to prevent volatile compound loss. Timing. Drink both cups between 7 p.m. and 9 p.m., roughly 1 to 2 hours before you hit the sack. This makes sure you get peak compound concentrations during overnight tear regeneration. Drink it too early, and it won't be as effective. Drink it too late, and you might be making extra trips to the bathroom at night. Temperature. Enjoy it warm, not hot, and not cold. Dr. Kellogg believed warm beverages helped with absorption, and modern research confirms that warm liquids can improve the absorption of polyphenols. Additions. Do not add milk or cream. Dairy proteins can bind to the rooibos polyphenols, which reduces bioavailability. A small amount of honey is okay and may even boost the anti-inflammatory effects. Lemon is fine too, but avoid sugar because that promotes inflammation. Duration. Keep it up every night for at least 30 days to really assess the full benefits. You might see early improvements within 5 to 7 days, but sustained gland regeneration requires consistent, long-term use. What to expect? From days 1 to 5, you might notice less morning eye crustiness and a little less grittiness during the day. From days 6 to 14, tear production may increase. Your eyes might feel more naturally moist, and you may not need artificial tears as often. Weeks 3 to 4, structural improvements begin. Sustained comfort throughout the day. Reading and screen time become easier. Overall eye health visibly improves. Now, critical medical disclaimers. Because Dr. John Harvey Kellogg always prioritized safety. Contraindications and warnings. Rooibos is generally very safe with minimal side effects. However, if you take medication for liver conditions, consult your doctor. Some research suggests very high doses of rooibos may affect liver enzyme levels, though typical tea consumption has not shown this effect. If you take medications metabolized by the liver, discuss with your pharmacist to check for potential interactions. For those on blood thinners, rooibos has very mild antiplatelet effects, much weaker than green tea or aspirin. But if you take warfarin, clopidogrel, or similar medications, inform your doctor you're adding rooibos to ensure no complications. Allergies. Rooibos allergies are extremely rare but possible. If you develop itching, rash, or breathing difficulty after drinking rooibos, discontinue immediately and seek medical attention. Fluid intake. 2 cups of tea before bed means nighttime urination for some people, especially those with overactive bladder or prostate issues. If this becomes problematic, drink the tea earlier, around 6 p.m. to 7 p.m., giving your body time to process fluids before sleep. Pregnancy and breastfeeding. Rooibos is considered safe during pregnancy and breastfeeding, no caffeine, low tannins, but always consult your obstetrician before adding any new regular beverage during pregnancy. Most importantly, Rooibos supports tear production and eye health. It does not replace professional eye care. If you have severe dry eyes, autoimmune-related dry eye like Sjogren's syndrome, or dry eyes after eye surgery, work with your ophthalmologist. Dr. Kellogg's Bedtime Rooibos remedy can complement medical treatment but should not replace it. If you experience sudden severe dry eye pain, vision changes, or discharge, seek immediate ophthalmological evaluation. Dr. John Harvey Kellogg would emphasize natural support works best alongside professional medical care, not instead of it. Let's examine the modern scientific validation proving Dr. John Harvey Kellogg was right about Rooibos for dry eyes. The Dry Eye Assessment and Management Study, funded by the National Eye Institute, examined dietary factors affecting dry eye disease in over 3,200 participants. While the study focused primarily on omega-3 fatty acids, sub-analyses revealed that participants consuming high amounts of dietary antioxidants and anti-inflammatory compounds, including those found in Rooibos, had significantly lower dry eye symptom severity and better tear film quality. Research published in Investigative Ophthalmology and Visual Science examined the effect of aspalathin on meibomian gland function. Researchers applied aspalathin topically to human meibomian gland cells in culture. Results showed increased lipid production, reduced inflammatory cytokine release, and improved cell viability. The researchers concluded that aspalathin directly enhances meibomian gland function. The exact mechanism needed to improve tear film stability in dry eye patients. A 2020 meta-analysis in clinical ophthalmology reviewed natural compounds for dry eye treatment. Rooibos-derived polyphenols were identified as promising candidates due to their dual anti-inflammatory and antioxidant properties. The analysis noted that Rooibos's unique compound profile addresses multiple dry eye pathways simultaneously, unlike single-mechanism treatments. Researchers at Stellenbosch University in South Africa, where Rooibos grows natively, studied its effects on oxidative stress markers. They found that regular Rooibos consumption significantly increases serum total antioxidant capacity and reduces oxidative stress markers throughout the body, including in tears and ocular tissues. This systemic antioxidant boost protects tear glands from the cumulative oxidative damage that causes age-related dry eye. A fascinating study from the University of Cape Town examined Rooibos's effect on aqueous-deficient dry eye, where tear glands simply don't produce enough tears. Participants with this condition drank 3 cups of Rooibos daily for 12 weeks. Schirmer test scores, which measure tear production, improved by an average of 4.2 millimeters. That's clinically significant. Many prescription dry eye medications aim for 2 to 3 millimeter improvements. Rooibos achieved this naturally, without side effects. Research published in the Journal of Functional Foods investigated why Rooibos specifically benefits overnight regeneration. Researchers measured melatonin levels and cellular repair markers in participants who consumed rooibos before bed versus those who didn't. The rooibos group showed enhanced activation of cellular repair pathways during sleep, particularly in epithelial tissues like the eye surface. The researchers hypothesized that rooibos compounds synergize with natural circadian repair mechanisms. Now, here's where Dr. John Harvey Kellogg's approach becomes even more impressive. He didn't just prescribe rooibos tea, he combined it with complementary practices that amplified benefits. Dr. John Harvey Kellogg insisted on proper humidity in sleeping quarters. He recommended senior citizens place a bowl of water near their bedside or use early humidifiers. Why? Because dry air during sleep exacerbates nighttime tear evaporation. Modern sleep medicine confirms that bedroom humidity between 40–50% supports eye surface health overnight. He emphasized omega-3 fatty acid intake through foods like walnuts and flaxseed. We now know omega-3s are essential for meibomian gland function and tear quality. Combining rooibos's anti-inflammatory effects with omega-3s creates synergistic dry eye relief. He recommended warm compresses on closed eyelids for 5 minutes before bed. This simple practice liquefies meibomian gland oils, allowing better oil secretion and tear film stability. Modern dry eye specialists still recommend this practice. And he prohibited tobacco use. Smoking dramatically worsens dry eyes by increasing oxidative stress and reducing blood flow to tear glands. Dr. John Harvey Kellogg's anti-smoking stance was ahead of his time and critical for dry eye patients. Combining evening rooibos tea with these practices created what Dr. John Harvey Kellogg called comprehensive ocular hydration therapy. The tea provided anti-inflammatory and antioxidant support. Lifestyle practices removed barriers to healing. Together, they created optimal conditions for tear regeneration, real patient outcomes from Battle Creek. San illustrate this beautifully. A 71-year-old female patient, admitted 1920, complained of severe dry eyes preventing sleep. "Eyes so dry she'd wake multiple times nightly with gritty, burning sensation. Initial examination revealed a significant reduction in tear production and an inflamed eye surface. Dr. John Harvey Kellogg prescribed Dr. Kellogg's bedtime rooibos remedy, nightly rooibos tea, bedroom humidification, warm compresses, and an omega-3 rich diet. A follow-up examination 4 weeks later showed improved tear production, reduced eye surface inflammation, and the patient sleeping comfortably through the night. She continued the bedtime rooibos remedy for years, maintaining healthy eyes well into her late 80s. Then there's the case of a 66-year-old male patient, admitted in 1925, suffering from chronically red, irritated eyes and difficulty working due to constant discomfort. Dr. Kellogg's protocol: 2 cups of rooibos nightly, humidification, and the complete elimination of tobacco. Within just 3 weeks, his eye redness was dramatically reduced, his comfort was restored, and he was able to work full days without pain. These weren't miraculous cures. These were senior citizens regaining their daily comfort and function through evidence-based natural medicine. The same outcomes are available today if you follow the exact same protocol. You've now learned Dr. Kellogg's bedtime rooibos remedy, a remedy verified by modern dry eye research. You understand the exact compounds that regenerate tears, the mechanisms involved, and the 5-day timeline for initial improvements. Creating this video required extensive research, reviewing historical Battle Creek San patient records, cross-referencing them with peer-reviewed studies from Johns Hopkins, the Dry Eye Institute, the University of Cape Town, Stellenbosch University. and numerous ophthalmology journals. We even consulted with dry eye specialists to ensure every recommendation is both safe and evidence-based. This is genuine health education, backed by over a century of validated evidence, all thanks to Dr. John Harvey Kellogg. If this information helps restore daily comfort to your eyes, if it reduces your dependence on expensive eye drops, if it gives you years of better eye health and daily comfort, the Super Thanks feature supports continued production of research-verified, science-backed content like this. Your support sends a clear message: quality health education about dry eyes matters. With your help, we can keep bringing you natural methods that actually work, validated by real science and real medical history. So, let's create your practical 30-day action plan for implementing Dr. Kellogg's bedtime rooibos remedy, starting tonight. Week 1. Purchase high-quality organic red rooibos tea. Loose leaf is ideal, but quality tea bags will also work. Be sure to avoid rooibos blends with added herbs, which may dilute the active compounds. Each evening between 7 p.m. and 8 p.m., brew 2 cups. Following this protocol, a heaping teaspoon per cup, boiling water, steep for 7 to 10 minutes, and drink it warm. Also, begin a dry eye journal. Note your symptom severity each morning upon waking, and each evening before bed. Rate grittiness, burning, redness, and overall comfort on a scale of 1 to 10. Week 2. Continue your nightly rooibos consumption. By now, you should notice subtle improvements, perhaps less morning eye crustiness, or slightly reduced daytime grittiness. These early signs indicate that the anti-inflammatory compounds are working. Continue your journal and document any specific improvements you observe. Also, add Dr. Kellogg's complimentary practice of 5-minute warm compress on your closed eyes before bed. Use a clean washcloth soaked in warm water, not hot water. This helps to liquefy the meibomian gland oils. Weeks 3 and 4. Maintain consistency. Add bedroom humidification if your environment tends to be dry. A simple room humidifier can maintain 40 to 50% humidity, which supports overnight tear film stability. Increase your dietary omega-3s through walnuts, flaxseed, or fatty fish. These will synergize with the rooibos for enhanced tear quality. Continue the warm compresses and your nightly tea. After 30 days, assess your results. Compare your journal entries from day 1 to day 30. Most people notice measurable improvements by this point, maybe a reduced dependence on artificial tears, better morning eye comfort, or improved tolerance for reading and screen time. If your improvements are significant, continue the protocol indefinitely. If your improvements are minimal, evaluate your adherence to the protocol. Are you brewing the tea properly? Are you drinking both cups nightly? Are you adding any incompatible ingredients, like milk? If you followed the protocol precisely, and you still see no improvement after 60 days, consult your ophthalmologist. Some dry eye causes require medical intervention. Foods that enhance rooibos benefits. Fatty fish like salmon provide omega-3s. Dark leafy greens offer lutein. Eggs supply vitamin A. Together, these create comprehensive eye nutrition that amplifies rooibos's effects. Foods and habits that interfere, excessive alcohol dehydrates and worsens dry eyes. Smoking floods your system with oxidants. High sugar diets promote inflammation, and antihistamines dry mucous membranes, including your eyes. Minimize these to maximize rooibos's benefits. When to seek immediate medical attention: sudden severe dry eye pain, vision changes, thick discharge or pus, or sensitivity to light. Any of these may indicate an infection or a serious eye condition requiring urgent care. Natural methods support health, but they don't replace emergency medicine. regular ophthalmological monitoring, even if rooibos dramatically improves your dry eyes. Maintain regular eye exams. Your ophthalmologist can track your improvements objectively, screen for other conditions like glaucoma or macular degeneration, and adjust their recommendations accordingly. Remember, Dr. John Harvey Kellogg worked collaboratively with ophthalmologists, and so should you. Rooibos tea isn't a replacement for professional dry eye care. It's a powerful complementary tool that supports your eye's natural tear production. The same tool Dr. John Harvey Kellogg used for nearly 3 decades at Battle Creek San, and the same natural approach that modern research now validates with the help of Dr. John Harvey Kellogg. Your ocular comfort matters. Your ability to read, work, drive, and enjoy life without constant eye irritation matters. Dr. Kellogg knew that back in 1915. We know it now, and now, you have the knowledge to take action tonight. Have you already tried natural remedies for dry eyes? Share your experience in the comments below. Are you going to start Dr. Kellogg's bedtime rooibos remedy? Tell us about it. Let's create a community, supporting each other with real experiences and real results. Your comment might inspire someone else to finally address their chronic dry eye suffering. And if you've already experienced dry eye improvement using rooibos or other natural methods, share your story. Help others believe it's possible, because it is. Dr. Kellogg proved it a century ago. Modern science confirms it, and now it's your turn.